And at this time, Virginia, I'll go ahead and turn it over to you.
Hello, everybody. I hope you can hear me fine. I know that there is a hands up notation. I assume that people can use that as well. So if Allie will let me know if there's some problem with the communication. So what we're here to talk about today is your secondary claims for crossovers. And the first thing we're going to talk about is what is a crossover. I want to make sure that everybody understands this completely. A crossover claim is a claim that Medicare has allowed. Now, Medicare may have put the claim toward deductible, but that is still a crossover. If Medicare denied the claim, then it is not a crossover. So if Medicare allowed it, this is a crossover. Also, something else to clarify before I get started is when I talk about Medicare, I'm also talking about Medicare Replacement Plans. We process those two types of claims the exact same way, except for one caveat. And I'll talk about that when we get to that point. What we're going to talk about in this presentation is how to fill out those windows behind your claim on the portal. We're not going to talk about how to fill out just a basic claim because I think that you can all do that. If you need training on that, please let me know, or your provider field consultant. They're available to you from DXC to come into your office to assist with your filing or your questions, complex claims. So if you don't know who your provider field consultant is, please go to indianamedicaid.com. On the quick links to the right, when you get into the provider side of that, you will see contact us. And if you'll scroll down, you'll see a link to the provider field consultants for DXC, which includes a map as well. So you can find your field consultant, get in touch with them to get into your office to help you out. Also below that, just an FYI, are links to each of the managed care sites that have their field consultants. Because of course, as you know, DXC cannot assist you with managed care questions. So that being said, we're gonna move forward. So the first question is, when is the primary Medicare and Medicare Replacement Plan EOB required? Only if it is a denied claim. So when it's not a crossover, in other words, we need that EOB. So if Medicare denies the claim, we'll need that EOB attached to the claim. So we don't need it if it is a Medicare crossover where actual dollars were received, or even if the entire amount was put toward deductible or the coinsurance or the copayment. I've seen a very strange EOB where some of the Medicare replacement plans do apply the full amount to copayment. So that can happen. But you're going to enter the information into the portal in those behind screens. It's going to tell us, yes, they paid zero, but it all went to copayment or coinsurance. So we don't need that EOB attached. Okay. So when you get into the Medicare, well, not the Medicare necessarily, but into a claim, and you're filling out your claim to process a crossover to DXC. The screenshot in front of you is what is called step 1 on the portal. Up on the top left-hand side in the blue bar, you'll see step 1. This is where you put your member number, your rendering, and all that stuff. And at the bottom, you have to answer these 4 little questions. And at the bottom left, you'll see a little box that says include other insurance. In order for that other insurance, excuse me? Oh, in order for that other insurance to transmit into our system electronically, you'll have to check this box. Once you check this box, then hit continue. On the next page, at the top of the page, you'll start seeing the information you've entered, like your provider number, your rendering, your diagnosis codes, and below that, you're going to see what I call a tile. And this is what I call the tile, that blue bar that comes across. So the tile that says other insurance details. Another word we need to make sure that you're understanding is called the header. The header of the claim is your diagnosis, your member, your provider, all that stuff. So we're in the header of the claim. In the header of the claim, you're going to add the full payment for your entire claim and the full coinsurance deductible or copayment for the entire claim. So when you get to that other insurance details tile, if there are insurances listed there that are not relevant to your claim, you need to go ahead under the action column at the right-hand side and click remove, get rid of them. Because if they're on there, the system's going to expect something put in. So if it's not relevant to your claim, remove it. For Medicare, generally, you do not see the Medicare information here. So what you're going to have to do, you see that little red box here. What you're going to do right here is you're going to click to add other insurance right here. Okay? Then you're going to hit continue. When you do that, what you're going to get is that tile is going to open up. And I've messed up my screen here. Okay. Hold on. So you're going to get the other insurance details opened up. And when that happens, you're going to add just the information that I have red boxes around. All of these items have a red asterisk in them, with the exception of the TPL Medicare paid amount box. And that's because that self-populates with a 0, because you can fill this information out for your claims that are going to deductible. All right? So let's talk about this. So your first box, your carrier name, will be Medicare or the replacement policy name. Carrier ID for Medicare Part B, which is what you're billing, because we take these on the physician claim form, right? So it's a 08102 if it's traditional Medicare. If you don't know the carrier ID for your Medicare replacement plan, that's fine. Just put in the name of the Medicare replacement plan in the carrier ID box. Next, you'll see the policyholder last name and first name. That's your patient. Next thing we need filled out is the policy ID, and that's the Medicare number. Right below that is your relationship to a patient, and that's going to be 18, which is self. That has a drop-down box, so you can just choose it, or you can type in 18 and hit tab. Now, to the right of there is the claim filing code. This claim filing code is key to your claim coming to us as a Medicare crossover. When it is traditional Medicare, WPS, or I think it's Cabada or Cahaba or something like that, it would be MB for Medicare B. Now, here's that place where I said your Medicare replacement plans are going to be different. If it's a Medicare replacement plan that you've listed in the carrier name and the carrier ID, then you'll want to enter a 16. Again, that has a drop-down menu, so you can choose that, or you can just type in and hit tab. The next thing we need is what did Medicare pay? And as I said before, that could be 0, because if it went to deductible, you're still filling out these windows. And what this is what did they pay on the entire claim. Once you enter that information, you're going to click Add. And for some reason, I'm not able to. Okay, this keeps getting there. Okay. Sorry about that, guys. I'm not used to this system. There we go. When you click Add, Other Insurance Details is going to retract. It's going to close up. You're going to see what you've entered under your Other Insurance Details with the under the column of the number sign, you're going to see a 1, your carrier name, carrier ID, your group ID, which I've retracted because PHI, TPL Medicare paid amount, and the paid date, if you put the paid date, but it's not required in the header. Now, I already told you we have to put in the deductible, coinsurance, and copayment. To get to that screen, you have to, again, click on that number 1 next to the carrier name. What that will do is open up the whole window that you've already filled out with your Medicare insurance information, and then below that you're going to get a new tile that says Claim Adjustment Details. In that Claim Adjustment Details, and I know the word adjustment generally means contractuals, but that's not what we're wanting here. What we are wanting here is your deductible, coinsurance, or copayment. So under the Claim Adjustment Group Code, you're going to drop down list, you're going to choose PR. Under the reason code, you're going to either put a 1 for deductible, a 2 for coinsurance, or a 3 for copayment. Under the adjustment amount, you're going to enter the amount of the coinsurance, copayment, or coinsurance for the entire claim. You're going to click Add, and then you're going to click Save. When you hit Save, you're going to see that window retract. It's going to fold up, and you're going to see your PR here and what you put in. And there's another Save that you need to click. So what I'm going to tell you as just a point of education, in these windows, if you ever see a save after you've entered your information, make sure to click it, because if you haven't saved it all the way, it won't transfer this information on your electronic claim. So we're going to hit Save again. It's going to fold up all this window. So once you do that, you're going to hit Continue, and then you're going to get to the next screen, which on the portal at the top left says Step 3. This is where you will see at the top, you'll see your member number, your member name, your diagnosis code tiles, your other insurance detail tiles, and you see that on the screen in front of you. That other insurance details that you see above the service detail tile is the header information for the Medicare payment that you've entered. Now, we're going to go to the service detail. Now, for your type of claims, your detail number 1 is going to be the T1015, right? Your encounter code. So let's say that you've already got that entered. You've added it, and it retracted that line, and it folded it all up. So to get your Medicare information in there and to get your coinsurance information in there, you're going to click on the number 1 next to your encounter code, and that's going to open up some windows. When it opens up, your encounter code's going to be at the top with all your details and your payment, your charge amount. The next thing you'll see is a new tile that says Other Insurance for Service Detail. That's what's different about this versus the header. It says per service detail because we adjudicate per service detail at DXC since the new portal. Now, on that, you're going to use that red box that says Other Carrier. You're going to do a drop down. You're going to choose your carrier, and it's going to be right there for you. Under the TPL Medicare paid amount, since this is FQHC or RHC claim, you're putting the entire Medicare paid amount still on that encounter code. So that billing has not changed. To the right of that, we want to know the Medicare paid amount. The paid date. So that is required at this point, and you see that it has an asterisk next to all of these boxes. So that is something that has to be there. If you have your Medicare EOB in front of you when you're doing this, or you have it pulled up on a second screen, then everything you need to put on this claim will be in front of you. Once you put that in, again, that's the payment. So you're going to hit Add. It's going to fold this window up. To get to the coinsurance deductible window, the adjustments window, you have to click next to your insurance carrier that was listed. So This is where it gets confusing, that clicking and clicking again. So we're going to click under the other insurance for service detail. We're going to click the line 1. And when we do that, it's going to unfold, expand, and you're going to see that claim adjustment details. That is right below your other insurance for service detail tile. Okay? So you see where you've entered your other insurance, Medicare, $1,250 for the payment date of 3/10/17. Below that is your claim adjustment details. You're going to put in the group code again, just like you did on the header of the PR. You're going to put in the reason code, which was the same as the header because it would make sense to put a different reason code, right? So the 1, 2, or the 3, and you're going to put in your adjustment amount, which should enter which should be exactly what's in the header because you're putting the entire coinsurance deductible or copayment for the entire claim on your encounter code. Once you've entered those amounts and those pieces of information, you're going to click Add. It's going to collapse that window. You're going to click Save, and it will collapse the entire window behind your service detail. So all you'll see is your service detail. You have to make sure to hit all the saves. So for your remaining details, your E&M code and any labs and anything else that you're going to put on your claim, then you have to go into that. You don't have to go into that detail. This presentation is for other provider types other than just your provider type. So they have to put it on every detail, but you would not put anything on your remaining details. Your provider type needs to put the entire paid amount and the entire deductible, coinsurance, or copayment on the first line with your encounter code T1015. Now I'm going to go past these next few screens because they're not relevant to you because they're on additional details, okay? Once you submit your claim, I don't know if you've noticed or if you've submitted any claims, you get a claim ICN, and right above that it tells you its finalized status. Since there's no attachments to these claims, it should immediately adjudicate unless it is suspended for a possible duplicate edit. And then a resolution clerk will need to review your claim and then determine whether or not it is appropriate to override that edit or to allow that edit to deny. So I think that is a wonderful, wonderful feature of this portal. Now, if you've already billed some of your claims on the portal and they've denied and you've been unsuccessful in billing these crossovers, I would say to use an existing claim to correct those crossovers now that you've got some information on them. So you would go to your search claims from your top bar on your menu and then put in the member ID and the date of service. When you're searching claims, I almost always, 99% of the time, I suggest that providers put in the member ID and the date of service because the reason being is that when you do the search that way, you get to see every claim that has ever processed through for that member, for your provider, for that date of service. And sometimes that is beneficial because I've had providers who only searched by claim ID and the claim had denied for duplicate, and they said, well, this claim's not paid. How could it be a duplicate? Well, when I have them go in and search by the member ID and date of service, they see that the claim is in paid status at some point, but it paid at 0. So they didn't feel the claim was paid. But if it is in paid status, it will cause any other claims to deny as a duplicate. So please do your search by member ID and date of service. And when you find your claim, you just click on that claim ID and then you move to the bottom of the claim. Now, before you copy this claim using the copy button, I encourage you to look at the claim EOB information right there next to that red arrow. We don't care about adjustment codes because those are HIPAA standard, and they're not really drilling down to the Indiana Medicaid detail of why your claim denied. So look at your claim EOB information and make sure the only reason your claim denied was for primary insurance. If it denied for a diagnosis also or anything like that, you want to make sure to correct all of your claim errors at one time. So review your claim EOB information and then click on copy at the bottom. Once you click copy, you'll get this new window that shows you can copy either just the member information, just the service information, or the member and service information, but you want to copy the entire claim. That is your option. So once you've clicked on entire claim radio button, you hit copy, and then you resume your billing from there. You'll need to re-answer all of your questions at the bottom and check your other insurance. Now, we've got a little bit of information here on this presentation that I'm going to go over with you just for reasons that it may be beneficial. So if the primary paid the claim, even if it was applied to the deductible, now not if it's denied, if it's applied to the deductible, make sure to check the include other insurance box at the bottom, and we're talking about somebody other than Medicare, okay? We're talking about other insurance. Check that include other insurance at the box and then continue. And then in the header of the claim, you're going to put what that other insurance paid toward deductible, and then you're going to put that on your encounter code. But you do want to include the EOB unless you have one of those ARC codes that will say applied to deductible on your EOB. If it's not on your EOB, you can't use that ARC code on the claim, okay? So I just thought that would be a little bit of additional information for you. Now, I talked about earlier adding attachments, and if you do need to add in attachments, below your service details on step 3 of your claim is a tile that says attachments. We now take electronic attachments via file transfer. So when you click to add the attachment, the transmission method is going to say file transfer, and there's also a drop down there where you can choose by mail like we used to do in the old system. So if you don't have a way to file an attachment transfer, then you can do it by mail, but we're going to talk about the transfer. It's just like adding an attachment to any other system you've probably dealt with. You choose the file, and then the attachment type is a drop-down list, as you can see, and in this example, I've chosen EB, explanation of benefits. So this would be for your TPL claims. If you have a claim that is not Medicare primary but someone else, and let's say that they did deny the claim. If they denied the claim, you're not going to click include other insurance on that first page of the portal. You're going to just fill out your claim. You're going to attach your EOB here. Once you've attached it, you hit add and save, and then you submit. And that's how you're going to bill those claims. Now, I do know until last week, there were some issues with primary denied claims that we were getting EOBs with, and we were denying them erroneously. Those claims can now be rebilled. If you're submitting claims with an EOB, that claim status that you get once you hit submit and confirm on your claim should say your claim was successfully submitted. The claim status is process in pending or pending processing. I forget which the exact words are. I'm so sorry about that. But that's so that the reso clerk can actually review your EOB and then determine if the EOB is appropriate. for override of the edit. Now, we do know that your encounter claims EOBs don't have your T1015 on them. You still need to make sure that is written on there for these resolution clerks. The screen before this was just the confirm screen. So this is what I was talking about. Your institutional claim is successfully submitted. You get an immediate response. This is the response you want when you've submitted them as a Medicare crossover. Claim status, finalized payment, and then it gives you your claim ID in this area where the big black box is. For claims with attachments that need to be reviewed, you'll see the claim is pending in process, I believe is the words. So that is the end of once you submitted and confirmed your submission. Now, if those of you who want to fill out your crossovers with this TPL Medicare Special Attachment Form, we're going to talk about that. If you're going to send your claim in on paper, that's the only time you need that special attachment form. You do not need it if you're sending your claims via the portal. Of course, we always encourage you to use the portal or your own electronic transactions for submitting your claims because the system just processes them and we don't have to touch them. You will have to use the TPL Special Attachment Claim Form if you're submitting TPL with detail level payments. And that form can be found at the IndianaMedicaid.com website under the Forms menu. When you get to the Forms menu in the middle, you're going to go to Claim Forms Non-Pharmacy, and in that section you'll find this particular attachment sheet. And below the sheet itself, there's another link that gives you instructions. The form isn't required for inpatient or long-term care, but that doesn't affect you guys. This presentation is what we gave at the second quarter workshops. That's why there's some information in here that's not applicable to you. Okay, in front of you is the third-party liability TPL Medicare Special Attachment Claim Form. Okay. At the top, you see line 1 and line 2. We require the billing provider NPI and the group billing provider name. This is not the rendering provider's name or NPI. This is the group, your clinic. Number 2, member ID is required and the member's name is required. All of this information must match exactly with your claim and with the file that is coming in to us and the information on file. Number 3, list other payers in order of responsibility. Now let's talk about the sequence number, which is the first column on the left. Sequence 1 is always reserved for Medicare. And when I say Medicare, what do I mean? Medicare replacement plans as well. Sequence 2 is always other insurance, someone other than Medicare. So even if you don't have Medicare on your claim and all you have is, say, Aetna, you're going to fill out sequence 2. Not sequence 1. The health plan ID is not a requirement on this form, but the payer name is, not the payer address. The policy ID of the policy holder that was the holder of the primary insurance, and the pay date of the primary insurance. Now this form, I said, is for when you're filling out details of what the primary insurance paid. All right. So, on number 4, detail number 1, this is your encounter code. Payer sequence number 1, Medicare. So, Medicare paid. This is a crossover. Medicare applied my claim to the deductible, you see, because I put that under that deductible column. And to the right, my paid amount is 0. But let's say I also have a Medicare supplement. So I'm going to go and put in my supplement detail number 1, payer sequence 2. My supplement paid $10. The deductible, coinsurance, copayment, blood deductible, and psych reduction is not for any payer other than Medicare at this point, okay? You would enter your details number 2, 3, 4, whatever they are, payers, and you don't have any payment on those. So you don't need anything for those details. All right? You're going to send us your claim. Your Medicare crossover claim is going to have to be completed just like it always has. Field 22. The left-hand side of field 22 is your coinsurance and deductible. The right-hand side of 22 is how much they paid you. Even if it's 0, put 0.00. In field 29, which is right after 28, where your total charge is, field 29 is reserved solely for TPL, other insurance, not Medicare. So your Medicare payment does not go there. And just as a side note, make sure in field 33, you put the name and address of your facility as is listed as the service location on your provider profile. So the place of service is your clinic. That's what needs to go in 33, your clinic NPI in 33A, your clinic taxonomy in 33B. So the claim is going to look just like it always has when you used to bill it to us without the EOB. But now we need this TPL third-party Medicare special attachment form behind the claim. It's a requirement. Other insurance updates, and I just wanted to leave this in here because I know other people have asked, oh, they can't update other insurance anymore. Sometimes your Medicare Replacement Plan is listed as a TPL on the member's profile when you check eligibility. That is going to mess you up completely. You'll never get paid until that Medicare Replacement Plan is removed as a TPL. We don't list Medicare Replacement Plans. So to update that or anything else as far as your TPL for a member, you would go to your home screen. If you're in the billing office, then you all should have access on your home screen to secure correspondence. This is how you're going to communicate with the TPL unit, and you're going to request that we remove or add a TPL. Also, there's links for finance there. If there's an issue with a check, you know, maybe a non-claim specific payout or a non-claim specific reduction, you can get right to those units using that. But make sure that the secure correspondence you're using is appropriate. Once I click on secure correspondence, I'm going to get this screen. If I have previously sent any secure correspondences, I will see those messages where it says there are 0 messages to view. I'm going to click on Create New Message. This window is going to open up, and you're just going to put in a subject, of TPL update or whatever you want it to be, doesn't matter. In the message category, when you hit the drop down, you're going to see there's a lot of different units that you can communicate with. One of them being TPL update. You're going to click on that. You're going to give us your email address. You're going to confirm that email address. Now, if it's a TPL update, of course, we're going to need that member ID, or, you know, if it is specific to a claim, we're going to need member ID, claim number, date of service, different things like that. But for the TPL update, you're going to need the subject, message category, email address, confirm, member ID. Then down in the message, you're going to tell us what you want. You want something added, you want something taken off, what the situation is. As you see, there are red asterisks next to some line items, and these are required. In the message, let me just say, be as short and concise as possible. If you have more to say than will fit in the message box, I suggest you type up a letter and send it as an attachment. Show you how to do that in a minute. I've kind of filled this out, except for the email address. For instance, member no longer has Aetna insurance, submitted claim for data service, blah, 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 for office visit, claim denied for no coverage. So the TPL unit has to physically verify every TPL update they make. They can't just make an update based off of an EOB sent to them or someone saying that someone no longer has an insurance. We have to physically verify that they have or have not got the insurance. At the bottom of that screen, again, it looks just like it does on the claims. You're going to see attachments. Again, file transfer, choose the file from your desktop, your server, whatever, and then what kind of attachment type do you have? You're going to click Add, and then you're going to send that off to us. Right now, I think it's taken approximately 25 days for these to change. You will get an email from the TPL unit giving you a tracking number or a CTN number for your request when you send it. And you will see on the screen in the correspondence where it lists your previously sent secure correspondences. When it is closed, you'll get a notification that it's closed. Now, will they tell you did they add it or not? Sometimes they do, sometimes they don't. So I would go out to that eligibility, verify what was done. If it's closed and nothing is done, then I would definitely send them back a secure correspondence and ask them, okay, here's my ATN from my previous correspondence. Why was this not changed? Maybe they could not verify that a change should be made. And I wanted to just give you a few updates also. First things first, this rendering provider linkage denial EOB 1010 that may have affected a lot of you because renderings weren't always linked where they should have been. That linkage is imperative that it be done and your renderings be linked when they should be and they be indated when they should be. And again, that can be done on the portal. But nonetheless, it was originally we were suspending that EOB until August 31st of this year originally and putting it back into effect on September 1. Well, we found that we've received a lot of communication from providers with rendering linkage requests. We want to make sure to give ample time to have those requests sent in and worked. So there will be a recent bulletin, if it hasn't posted already, that suspension of EOB 1010 has been extended to the first of the year. Now that doesn't mean stop sending in your rendering linkages until December. I want you to keep looking at your profiles, making sure everyone who should be linked is linked. People who should be indated are indated. So just an FYI on that. Also, some of you use OPRs, and those OPRs have to revalidate, so that could be affecting some of your claims. So if you're getting errors for your OPRs because they haven't revalidated, you may want to contact them and tell them that we did mail the revalidation request to every OPR on file, and we mailed that to their mail to address that we had on file from their enrollment. So that's an FYI. The next FYI, paper claim forms. We will still be accepting paper claim forms come January 1 of 2018. However, all paper claim forms received at DXC must be the red and white claim form. Now, some of you also have dental services that you bill for in your offices, but the ADA form is only black and white, so that is an exclusion. But the institutional claims and the CMS 1500 claims must be red and white, anything received on and after January 1, 2018. So this is just a few little updates to help you out with your day. And that's all I have other than your helpful tools. Go to your reference modules and your medical policy manual when you're looking for information. Customer service is your first line of defense. Your provider field consultant is for your complex claims and on-site training. Excuse me. And written correspondence is for any NCCI edits or claim administrative reviews or appeals. Please do not send information to written correspondence for resubmitting a claim. DXC does not require quote-unquote corrected claim process. When you're correcting a claim, you just rebill the corrected claim to us straight out. Written correspondence will reject any request for a resubmission of a claim sent to them. That's all I have for you. So is there any questions?
This is Allie again. I've not had any come in on the chat function. But if anybody does want to send in a question, or if you want to ask over your phone and computer now, feel free. You can unmute yourself. Again, if anybody has joined since the beginning of the meeting, please do use the chat function to let me know what facility you're attending on behalf of. I'm also chatting out to everybody a quick survey link. We really need, as much as we need to know what facilities you're from, we'd love to have your feedback. Again, it's what helps us have these free presentations. That survey link that I've shared with everybody will certainly take you 2 minutes or less. And I do have somebody here that's asked for the recorded slide presentation. Can you make that available to us, Virginia?
The what?
The slides.
Oh, can I shoot the slides over to you?
Yeah, can you share those with me?
Oh, yeah, I'll shoot that over to you.
Okay. I will give everybody my email address. It's aorwig@indianarha.org. I'm sharing that in the chat function as well. If you just drop me a line, I'll be happy to share those slides with you. Any other questions?
I think I put them to sleep.
Okay, well, we'll hold on the line just a moment more in case anybody wants to ask, but we do appreciate you being here today, Virginia. It was great information. We really appreciate your time and the time of everybody that was able to share with us today. So thank you very much.
Thank you.